All right, good afternoon, everyone. Thank you for joining us. My name is Rob Fischer. I'm a faculty member at the Jack Joseph and Morton Mandel School of Applied Social Sciences at Case and direct our master's degree in nonprofit management. On behalf of Cleve Gilmore, our dean, I'd like to thank you for joining us this afternoon for what is the second in a series of webinars that we've been putting on. If you weren't able to tune in on April 29th, we had a session on nonprofit financial decision-making during times of crisis, and that is taped and available on our website if you didn't get a chance to join. Today, we're turning our focus to more of the leadership aspects of crisis, and we have a really dynamite panel. But my job is to get out of the way and introduce our moderator, which is Linda Springer, who is a longtime faculty adjunct at the Mandel School and who joined us after 10 years as the executive director with Social Venture Partners of Cleveland. And I'll just mention she's also a recent recipient of our Outstanding Teacher Award at the school. So she's a wonderful person to guide us through this. My only job will be to periodically jump in with either questions or keeping us on time. So thank you for joining today. If you, one technical thing, if you prefer to see a focus on whoever's speaking, you can select the speaker view in the upper right. If you don't want to see the whole panel, some people like to see everybody at once. Some people like to see just who's talking, your choice. And with that, I'm going to turn it over to Linda.
Hey, thank you, Rob. And I'm just really delighted that so many of you could connect with us this way to talk about this important topic. I have just a few slides that I want to share with you, and one of them lists the panelists. So as I introduce them, I'm going to share my screen and show this slide, and I'll just give you their names, and then they'll each give you a little bit more information about themselves. So just 1 second while I share the screen. Oh dear, this says the host disabled attendee screen sharing. We didn't troubleshoot that part.
I've given you permission now to share, Linda.
Great, okay, I'll try that again. There it is. And let me enlarge this. So our panelists today are Sherri Brandon, who is an MNO alum, and she's the executive director of Front Steps Housing and Services. We also have Phyllis, who goes by 7 Harris, also an MNO grad, executive director of the LGBT Community Center of Greater Cleveland. Eric McGarvey, also an MNO, executive director of Summer on the Cuyahoga, and Danny Williams, MNO, who's president and CEO of Eliza Bryant Village. So I would like to ask each of them to just tell you just in a sentence or two about their organization, what their organization does, and who they serve. Danny, let's turn that over to you for that brief introduction.
Thank you, Linda. Well, let me tell you, for those who are not familiar with Eliza Bryant Village, we're a nearly 125-year-old nonprofit that serves some of Cleveland's sickest and poorest residents. We were originally founded in 1896 as the Cleveland Home for Aged Colored People. And the key distinction I think that we still hold is that we're the oldest still operating African-American founded long-term care facility in the country. I'll just add this last point that in addition to our skilled nursing, we also have 149 units of affordable housing, an adult daycare program, and also an on-site dialysis center that we function in collaboration with the Centers for Dialysis Care.
Okay, thank you. Phyllis, I'll turn it over to you now for a little bit of a deep dive into your organization.
Sure. The LGBT Community Center of Greater Cleveland celebrated 45 years this year on May 8th. And we serve the LGBTQ community across Northeast Ohio. We have a new facility. We're coming up on a year in a new facility over in Gordon Square. And as an anchor organization there, we provide services for LGBTQ youth through our QU programming on up through our SAGE programming. And I always remind people that LGBTQ people do get old, and so we have programming for our seniors there, and just a number of other programs around education, advocacy, support, and celebration. So our Pride event that happens in Cleveland is produced by the center. Any advocacy efforts that you see happening around LGBTQ rights and respect, the center is involved in. And so direct service, outreach, education, advocacy, and celebration. That's what we do.
Thanks, Phyllis. And I apologize. I see that I left the Q off of the name of your organization. So sorry.
Yeah. There's no Q. We have a generational argument about that. So you'll notice that when we did change our name for our strategic planning process, I think now 5 years ago, there was an older generation that was not comfortable with the Q and a younger generation that's all about it. So my compromise was that we never take community out of our title if we're not going to add the Q and all the other alphabets to.
Okay. All right. Thanks for that clarification. I will next turn it over to Sherri for a little bit about her organization.
Front Steps Housing and Services, for many of you who may not know, is formerly Transitional Housing, Inc., located on West 25th. We are a behavioral health organization that offer permanent supportive housing to individuals who are chronically homeless in Cuyahoga County. We have 60 units of housing currently. We provide all levels of the mental health service modalities, as well as we're building a new facility in Ohio City, Tremont area. No, near West Development, I'm sorry, Ohio City, 68 new affordable housing, 1-bedroom apartments. We broke ground last year in June. We're 70% complete, expected to move in September, October of this year. And so again, we service the most severe client in the homeless community. We provide the supportive services as well as the permanent supportive housing for those individuals.
All right, thanks, Sherri. And last but not least, Eric, tell us about Summer on the Cuyahoga.
Thank you. So Summer on the Cuyahoga's mission is to recruit talented students for unique experiences through paid summer internships that lead to lasting networks in the greater Cleveland area. How we do that is we first are the conduit for paid, meaningful internships between employers that include startups, nonprofits, for-profits, and the students are from 8 partner schools, including Case Western. And we have had over 1,200 students be part of the program since 2003 when we started. In addition to the paid internships, we offer cost-free housing for them while they're here in Cleveland, 40 to 50 events and activities to really capture everything that Cleveland has to offer, all the cultural gems, all the highlights like our Playhouse Square and everything in between, and also the challenges that Cleveland faces so that we can help young professionals that may consider moving to Cleveland or a city like Cleveland get engaged in helping to solve some of those issues. In addition to that, we pair them with alumni and a lot of networking opportunities. And so traditionally we have 70 students in the program each year about.
Okay, great. So you can see that Rob put together a really great panel with a lot of diversity in the organizations and the missions and the people that they serve. So I want to give you just a little bit of context about the way we're looking at the term adaptive leadership. And so who is adapting? When we say adaptive leadership, we don't mean that this refers to a savior who swoops in and solves problems for people. Adaptive leadership is very follower-centered, and it really implies that the leader is mobilizing people to address change. And I want to give you just a few of the concepts that we're looking at with adaptive leadership behaviors. And the first is that the leader needs to see the picture. And some people refer to that as getting on the balcony. But the leader needs to some time for clear thinking, really be able to step out of the fray and be able to find perspective in the midst of this challenging situation, but still stay connected to the situation and to the people. But the leader also needs to really identify the challenge. Adaptive challenges are often not clear-cut, and they might not be solvable by the leader's current skill set or their current expertise. So it's important for the leader to be able to seek advice if necessary, and to really be able to see with new eyes, just to drop preconceived notions and really have fresh thinking. The third behavior is to balance decisive action with participation. And in a crisis, this is a time where we do need decisive action, but we also know that too much authority can really be debilitating, and it decreases people's confidence to be able to solve problems on their own. So it's important for the leader to be able to listen and to be open to gain the engagement and the buy-in of the people that they're leading. The next behavior is to regulate distress. And because a crisis requires changes in the priorities, the beliefs, the roles, and the values of everyone, it's really important for the leader to help people to get through the crisis by providing a vision for the future. So one way to do that is to create a safe space or a holding environment, some place where people can confront their deeply held positions, and really a place to help people to shift their values and their perceptions if that's what's required. And it's also important in regulating distress to depersonalize the conflict. And sometimes you need to really hold courageous conversations and face the brutal facts, because people might want to blame others, and it's just really important to depersonalize it and look at the facts of the situation. And the fifth behavior is to focus on the tough work and not avoid it. You really do need to maintain disciplined attention. And one thing that helps is, especially in this situation where we've had to really change the way our organizations operate, it's really important to distinguish between the expendable parts of the organization and the essential parts of the organization, and help the people really address the change and not avoid it. And some of the symptoms of avoidance behavior might be that people are just ignoring the problem, or they might blame others. They might blame authority, they might blame you, they might blame coworkers. Another avoidance tactic is to just attack the people who want to address the problem. Or some people might pretend that the problem doesn't exist. They might think it's okay to go on the way that, that they were currently doing things. And another avoidance behavior is that some people might just work really hard, but on areas that are unrelated to the problem. So those are just some of the overview of some of the leadership behaviors. And we next are going to hear from each of our panelists on some of the ways that they have used these behaviors in their organization to work through this crisis. So we will now get the examples from the Cleveland leaders. And I am now going to turn it over to Danny Williams to talk about some of the things that he did in this organization, in this crisis. Danny?
Thanks, Linda. First of all, I think I'd be remiss if I didn't thank Rob Fischer for inviting us all to talk about this, one of the most gut-wrenching experiences I think many of us have had in our professional careers while we're going through it. So this doesn't even get to be a retrospective. This is the kind of things, decisions we're making, right or wrong, some of them painfully wrong, but things that I think that we are all learning from as we go. So, let me start my comments with this observation, that our acceptance by our peers, by our colleagues as a so-called adaptive leader doesn't start on the first day of the crisis. It started weeks, months, sometimes years before, grounded in how we've reacted to other emergencies in our organizations, whether it's a fiscal, problem or a programmatic issue or an ethical issue. What have we shown that should give anybody any confidence that we have the ability to help facilitate a successful transition through the current crisis? One of the things that I realized when I started my current position, I've been here about 3.5 years, is because I did not have a long background in long-term care, that I needed to do something early on to give the staff a reason to listen to my advice and counsel as we dealt with issues from time to time. And so the first thing I suggest to the board is I go back and get a nursing home administrator's license, which I spent the first year of my tenure doing, going through an internship where I put on scrubs and I cleaned people's space and changed beds and worked in the kitchen and served our residents as a way of saying, at a minimum, there's no job here that I'm too good to perform. Now, obviously, I didn't do anything clinical, but all the other kinds of jobs that needed to be done in a nursing home, my message was, these are all important jobs, and I need to understand it if I'm going to offer try to add any value to that. So I did that, and then there were a couple of other early crises that required that I articulate for the board how we work through some major concerns. One, I'll just give you one example, was an empowerment zone loan that we had taken out some 15, 16 years earlier in order to absorb a nursing home that was failing at the request of the city. So he said, would you take this on, and facilitated us getting an empowerment zone loan to make an expansion to make that happen. The problem is, in my first year on board, I learned that the balloon payment was going to be coming due the following year, and we didn't have the $1.8 million that was going to be needed to pay off that loan. So we were able to pull together a team of board members, other staff members, approached the city, and in essence made a proposal that they ultimately accepted, resulting in the forgiveness of that $1.8 million loan. So coming in and basically saying, listen, I need to learn what I'm doing here, even though I'd worked for 10 years in a different healthcare setting. It wasn't the same thing. I need to help us get past an emergency, fiscal emergency, in collaboration with board leadership and other staff leadership. I think those things helped then when we're facing the current challenge for folks to say, all right, we'll at least give you the benefit of the doubt as you suggest a strategy for us working through this current dilemma. So my point being, it's not cast in stone, but you can't ignore the fact that whatever reputation, whatever grounding that you have developed before the crisis hits is going to help or hurt you as you then try to encourage people to have confidence in your judgment. Okay, but now let me just one other comment about that, because what people are going to look at when the crisis hits is how you are dealing with some of the promises that you've made before the crisis. So, for example, what happens to your so-called open door policy? When all of a sudden you've got all these things coming at you, do you maintain that? Do you, in our orientation, we often say we encourage people to act as leaders in whatever their sphere of responsibility. Well, do you continue that approach when there's crisis, even though the stakes are much higher? They'll also, when we often offer this bromide that our staff are our most important assets. Well, do you demonstrate that? Do you make sure that staff is compensated appropriately when they're putting themselves at greater risk? So they're going to hold you to things that you've said in the past. So let me take just a few minutes. We've got a very brief time to share with you, and I want to talk about a couple of the areas that Linda mentioned. Seeing the big picture, balancing decisive action with participation, and regulating distress. Those are the three that I want to talk about for a little bit. In terms of seeing the big picture, one of the things that I had to get comfortable with early in my professional career was spending maybe an inordinate amount of time just reading. I probably spend an hour or two a day just making sure that I'm not surprised by something that's developing on the landscape, whether it's the Wall Street Journal, New York Times, a trade journal, whatever it is, just making sure that there's not something going on that needs to be incorporated into our strategy that I may not be aware of. You know, there's a word that you hear. If you had to pick one word that you've heard more often in the last 3 months than probably any other time in your life, that word to me would be unprecedented. How many times have you heard this current crisis spoken of as unprecedented? Well, it may be to a degree, but the reality is how people react to this crisis, those things are not unprecedented. People fear for their jobs. They fear for their safety and the safety of their families. You know, they fear for their own reputation, their professional reputation, especially in an area like where I'm working. The nursing home industry is really being demonized. You know, we care for some of the sickest, frailest folks in society. And so if you think about it logically, you would expect there are going to be greater levels of infection and fatalities in a place where you've got a lot of really sick people. But, you know, that's still not an easy thing to accept. And so people are concerned when folks find out that they work at a nursing home where there have been illnesses and fatalities, they think about you differently. And so there are some natural concerns about that. And I think as leaders, we have to take into account how people you know, are feeling about it, what their concerns are about that. You know, and as you hear how the media talks about this current crisis, you know, one of the things that I picked up is that, you know, they don't focus on, people don't change behavior or accept what you're saying based upon some sort of logical linear argument. That's not what convinces people or changes their behavior. It's really, can they find something else they can connect it to? You know, is there an analogy? And you'll notice in the media when they talk about this, they'll use various analogies. They'll talk about 9/11 and how we came through 9/11. They'll talk about Ebola. They'll talk, they'll talk about even the 1918 flu pandemic to help people at least get a feeling about what it is that we're going through and that there is hope that we can get through this. Just like we got through those other things, we can get through this challenge as well. And so one of the things I would encourage is to think about what kind of analogies, what kind of success analogies that you can conjure up for folks. You know, it reminds you of the old Maya Angelou quote that people will forget what you said, they'll forget what you did, but they'll remember how you made them feel. And that's really important in the midst of this. As you're looking at the big picture, how do you help people feel that they can get through this in a successful way? The other thing that I did on this big picture issue was to remind us who we are. So for example, within hours after Dr. Acton issued her stay-at-home order, I sent out a memo to our board and to our staff. And I made a decision there to send it out to both at the same time. Often you're tempted to have different narratives for different audiences, but I thought it was important that the board and the staff hear at least what I thought they should take away from this stay-at-home order at the same time, meaning you're both important audiences and you both deserve to hear the same thing. And one of the things, I won't go through the whole thing, but one of the things that I emphasized was to remind us that we have said certain things about who we are as an institution, and now's the time for us to live up to that. We've talked about how we're an anchor institution. We're the largest employer in Huff. You know, there are a number of attributes that we emphasize. Well, now's the time for us to stand up and to make those things a reality. So again, just reminding us who we are in the face of the big picture. Now just take a minute or two about the other two. You know, this balancing decisive action with participation, you know, I think it's really important that you seek counsel, that you allow this to be an opportunity for other leaders to emerge. But you can't just seek counsel, you have to actually incorporate what they suggest to you. Because that'll start to ring hollow if you bring people in, encourage them to give advice, and then you never take one bit of their advice. So, you know, seeking counsel from key thought leaders within the team is really important. You know, it's difficult in a crisis to delegate, but delegation is really important. and focusing on the outcomes as opposed to the details of how they go about achieving the articulated goals is a key piece of it. You know, I'll give you one example of how it's important to bring the board along in this process as well. A question's come up recently about whether or not we should try to become one of the isolation centers, one of the locations where you actually are saying, yes, we invite more COVID-19 positive patients in. We've developed some expertise in dealing with them, and we should invite them in. There's some pros and cons to that. And I think you have to be open to listening to the pros and cons and accepting where that discussion ultimately takes you. That may be something that you may not initially agree with, but I think you do have to be willing to have that participatory process. And you also have to allow, if you're going to delegate, allow room for mistakes. Last thing I'll talk about on this regulating distress issue, people are going to be very anxious. Regular communication about the status, the plans, how things are changing are essential. You know, I've tried to put out at least weekly memos about where we stand in terms of infections in our institution, but also steps that we're taking to address on the clinical side and also to make sure that financially we can weather the storm as well. But you also have to give people a place to vent. There are a couple of members of my executive team who, to borrow a phrase, when they're under stress, will cuss like a sailor. And so I have to make sure that they can come into my office and feel free that they can vent with whatever language they need to use to vent. We can talk it through, and they're comfortable that that's not something that will ever be held against them. And then they can, with that relief, they can go back and you know, pursue their tasks in a professional manner. But the other thing, the last thing I'll leave you with is you've got to be willing to acknowledge when you've made a mistake. I screwed something up several weeks ago. We changed our protocol. Just to give you an example, our protocol is to take temperature and to answer an exposure questionnaire as you come into work. But a little bit later on, the decision was made, we need to do that as people are exiting as well. Check the temperatures they're leaving and also ask them the same protocol. Well, I think the day after we started that, something distracted me as I was at the front desk, and I ended up walking out without going through that exit protocol. I didn't realize it until I was in my car driving away. Now, what I probably should have done was turn around, go back in, and do it right, but I didn't. It was brought to my attention later. And so at one of our stand-ups, you know, I had said, listen, guys, I owe you an apology. You know, we established a protocol, and I made a mistake. I dropped the ball, and I can't drop the ball. And I told him what it was, and I apologized. I said, you know, obviously since then I have been very conscious about observing that, but I can't be in a position where I'm asking you to do something and I'm not modeling that behavior. So I, you know, asked for their forgiveness. It wouldn't happen again. But you got to be willing to acknowledge when you make a mistake. So with that, let me stop, and I guess there'll be questions later, and I'll turn it back to Linda. Thank you.
Thank you, Danny. I really like your term success analogies as a way to give people hope and help them with the distress. That's great. I just want to reiterate, if you do have questions, you can put them in the chat, and we will try to address as many of those as we can following all of the speakers, all of the panelists. Now I'll turn it over to Phyllis Harris. Phyllis?
Thanks. There are a lot of key points in Danny's presentation. I'm notorious for living through the experience and then realizing, oh, that's what this is, and going back to really sort of like analyze what took place, how it took place, and where it fits within the theories that, you know, we've learned and heard about. And so I love it when I do that. Certainly when I do it, and it's after my experience as an MNO years ago, and I'm like, oh, so that's what they were talking about. So it was a really great opportunity to implement this theory, and I didn't know what I was doing it until afterwards. I'll say that. My once the news around the coronavirus hit and the stay at oops, my internet says it's unstable. Hearing me okay?
We are.
Okay, so once the news hit about coronavirus and the stay-at-home order, as a relatively I guess, an organization that went through a lot of rapid change and growth within the last 5 or 6 years or so. My small board of 8 people were very nervous. We had just opened a new facility. We were incurring expenses that we had projected, but the reality of it was hitting. And so they were very nervous and are very conservative as when it comes to, our finances. And so their immediate reaction was to tell me to come back to them with a plan to reduce our staff size, our budget to 50%, which is primarily, our budget is staff salaries. There's other stuff, as we all know, and after getting off the phone and taking a minute and telling them I was gonna need to take a minute, I went back to it and I said, we got to look at the big picture. And so I really loved that this is part of it as the first step. And the big picture for me happened to be that we are an organization that serves individuals who are marginalized, discriminated against, have lots of challenges, including living with HIV, some of us immunodeficiencies, lack of access to healthcare, adequate healthcare or healthcare that takes in consideration who we are and how we live, food insecurity, housing insecurity, all of these things. And so the big picture for me is that this was an opportunity for us to do what we know how to do well, which is to be activists. And so I said to my my board leadership, I said, we are the people we serve. The impact of the coronavirus is going to be huge on all of us, and certainly the LGBTQ community, those of us who are most vulnerable in the community. And we have this opportunity in that we have this new presence, this new building. We have a sustainable funding model that we're all excited about. And we have what it takes to get through this. This is not the time to run. We need to, I'd like to pay attention to what how our staff are feeling. If they're willing to do this work, we certainly have the capacity, and I proved that we have the capacity to pivot to online programs and stay in connection with those who are most vulnerable by way of phone and other methods. And in order to really have them see this, I couldn't just say it, even though I feel like there are other incidents and opportunities throughout the years where they've seen this type of leadership in play. It still wasn't enough just to say it because of this unprecedented thing that we were all going through. And so what I did is I brought together a group of experts and I did it in quick fashion, and it felt really good that people responded. And the experts included someone on the research side of things who knew to speak that language about public health and what this crisis we would be facing. I brought a nonprofit expert, Danny Robbins, the John Carroll program, somebody who knew about leadership. I brought in fundraisers, Nancy Mendez from United Way. I figured United Way would lend some credibility. The fact that she worked there and was in the room with other foundation leaders in terms of what they were going to do. And then I brought in another retired but not really person, Bob Kagan, who works on, who's the chair of the Association of Fundraising Professionals. And those are the folks that I thought of quickly and said, if I can get their buy-in, and I know that they think big picture, we'll have some sound advice from these individuals. And we developed a case study so that my board leadership could see it. So our case study included the history of the organization, where our finances were at the time, what we had forecasted out for our fundraising efforts, and money we were going to raise. If we had to cancel everything, what would that look like? And then we asked them to all read the case study. We sent them our operational budget. So this is where transparency and adaptive leadership comes up. why hide it? What's going on? You know, we shared our operational budget, we share our fund development plan for the year, our staffing structure, and you know, how many folks on staff were direct support, how many others are behind the scene. And they had a lot of good information. And then we asked them to get us back, get their advice back to us within like 3 days or something, which was incredible. They all did. And the Danny's point on, you know, like getting that advice and doing something with it has also is super pertinent, because we got the advice, they all weighed in. And then my board just sort of like sat there for a minute, because it's unprecedented. What do you do? Like, so I'm not blaming them. I'm just saying, you know, they're looking for leadership themselves. We went back to that information, and really the opportunity to continue and stay the course, and know that we're going to be faced with things that maybe we don't know what to do with, but use our resources. The staff saw, what the staff saw is, I was transparent with the staff, you know, and I said, look, this is the situation we're in. Here's the capacity we have currently, and here's what we can do with that in order to be able to continue to serve the community, to show leadership ourselves as an organization, and people working within, nonprofit practitioners working within our organization to get this done. And so what they saw was, I think my willingness to problem solve, to seek advice, to speak out, to think long-term about the impact on our community, and include them as part of the community, which I might have the benefit of that other organizations might not have, but certainly the benefit of we are who we serve, and that mentality allows us to really produce some great programming and make good decisions on behalf of the LGBTQ community in general. And so, you know, that was my example, in terms of really thinking long picture and getting other folks on board to be able to do that. And so including my board members, and not just thinking they're just going to listen to me because I got a cute swollen face, but because, you know, other experts are around and willing to help. And they also were able to say, it's going to be important that your organization is healthy and does well through this crisis, because we know on the other side, we're going to need you. And so it resulted in a 10% reduction that did not impact my staff, and my board really focusing on what I needed them to focus on, which is the PPP loans and all of those other things to get us going, to make sure that we would be okay. The reputation and the behavior of and how I made people feel before, how to make, being focused on how you make folks feel was really important. And we had some opportunities around that as an organization. When the Pulse nightclub shootings happened, I didn't know what to do. But what I realized is the community had an expectation that we lead, that we be there for comfort, for safety, for guidance, as a place to grieve. And once I learned that, and so this has been a slow sort of like trajectory for me, and really seeing how to implement these theories that I learned as I was living them. I knew that people were counting on us in a way that was hugely more significant than that I was aware of. But once I understood that, I knew it would apply to what we're going through right now. And so, you know, I think I was able to pivot and be able to say, the community is going to expect this. And so this is how we're going to try to meet that need. And I included my entire team to be able to do that for feedback and support. And they have been innovative and creative and focused. And sometimes, you know, they want to do extra things, and I help them refocus, to reprioritize as we're getting information as we go along. And that has been super important too. I'll stop there for now. We're doing all right.
Yeah, thank you, Phyllis. Those were great examples of the leadership behaviors we talked about, seeing the big picture, setting the vision, getting the buy-in, seeking advice. Excellent examples, thank you. Let's turn now to Sherri Brandon. Sherri, you're on mute.
sorry. So Danny Williams was spot on when he talked about having a historical picture and a historical experience. At Front Steps Housing and Services, I have had to navigate the organization through several crises, starting in 2009 when we had an economy crash, and we had lost all of our funding out of our endowment, and I had to navigate the organization through that. And then shortly after that, the organization went through a complete shift. We had lost over half of our funding, and so people were all nervous, and I was afraid because I didn't know what to do. I had never been in that situation before. And so I had to garner the support of my board. I had to make sure that our staff and our clients knew that I knew what I was doing. And I didn't know what I was doing, but, I worked through the steps and I made sure that the agency came out on top and in a positive direction. But when the COVID hit, no matter how much experience you have as a adaptive leader or a leader, period, every crisis is new. Every crisis requires you to pull some skills out of your bag that you didn't know you had and that you tucked away. And so even though I had already been through navigating the organization through crises, this was just so new for us. And so when the crisis, the coronavirus first happened, we began to restructure our organization and make sure that we had sanitizing stations all around our building, because in the beginning, that's what the CDC was saying. So we did that. We consistently educated our residents, because now I have two populations of people that I have to protect. One is my residents, my clients who reside in the facility, and then the other is my staff. Usually it's just you protect your staff, you protect your residents and you're okay. But in this case, I had staff who had some apprehensions. I had residents who had apprehensions. And so when you say looking at the bigger picture, I had to step back, take a deep dive look down. I couldn't stay in the thick of things, because if I continued to focus in the thick of things, I could not make effective decisions. I was too far into the problem. And so what I did was I stepped back and I had to do a bird's eye view, and I looked into the organization. I kind of dissected it. And so one of the first things I did was I looked in my organization to see who are my emergent leaders. Who was the person that I could personally work with to make sure that we had a great plan for the organization during this pandemic. So I chose my person, and we worked at midnight, actually, because we had other things to do during the day. So we got on a call at midnight, we set up Google, and we worked in the application. I talked, she typed, she talked, I typed. And so that's how we were able to craft our first plan. We didn't have time for the board to approve it and then implement it. So what I did was I sent it to a select few board members, my executive committee, said, hey, listen, this is our plan. This is what we're implementing. This is what's happening. Take a look at it. I'm going to be sharing it with staff tomorrow. And so that was the first thing we did. And so we shared it. Then we realized this COVID-19 plan was a living, breathable document that we would consistently have to make changes to. So we were okay. We were like, okay, we've done the sanitizing stations. We've done everything we've had to do. And then the stay-at-home order came. And so now it's a whole nother crisis, because we had already educated our residents and our staff. We had already done that. Then the stay-at-home order came, and I remember hearing it on that Sunday. And I had just left church, and it was a stay-at-home order. And we would be staying, I think it was going to go into effect that Monday at midnight. I didn't have Monday at midnight to wait, because I had two populations of people. I had 68 units to attend to. And so I immediately called a staff meeting on a Sunday. Everyone meet me at the agency. And so we went to the agency, and I had to step back and look at everything. I had to make sure residents had food because I didn't know where food was coming from. So I had to make sure we had food. We have a small pantry. We had to package like 60 some emergency bags of food, making sure that the residents had something to eat in this crisis situation, because now it's at the end of the month and there's no funds for them. And so we had to make sure that there was food on site. I also had to make sure that I eased their tension and educated them in terms of what was happening to them, because now I'm dealing with chronically homeless individuals who have severe mental disabilities, and any disharmony to them could be devastating. And we have found that it was. And so we worked together as a team. My entire staff packed bags. We did everything we could do to make their home environment comfortable. And then I had to look and say, okay, my clients are at home, they're protected, they're in their space. I had to increase my security from 17 hours a week to now 24/7. So now I had to increase the security to secure the facility. And then it was, now I have to deal with my staff. And so one of the things that we did was we all prepared to do work from home. My clinical staff did telehealth. We were in telehealth every day. I stayed in there. We had consistent meetings. So we had 3 meetings a week, and Monday, Wednesday, and Thursday. And those meetings were not just to keep us checked in, but to make sure that my voice as the leader of this organization was navigating the storm. I was the voice in the ship that was navigating us through this storm. And so we stayed consistent. We had consistent conversation, consistent communication. We kept ourselves apprised of all of the coronavirus changes. We had one employee who was one of the emergent leaders who stepped in and made sure that she was in charge of all the pieces of information when COVID hit, how we were going to respond, what was out there, what our governor was saying, and suggestions of how we should respond. We eventually had to implement a crisis line because our residents needed somewhere to conversate after hours. And so we developed a crisis hotline where not only our residents, but folks in the community who was feeling some kind of way had avenues and phones that they could contact us and just talk to someone. And usually it was a peer on the other line. And so we implemented that as well. And then we ran into some challenges because when you're doing telehealth, you're not prepared for it. You're just doing it because you're being flexible. You're moving on your feet and you're thinking on your feet. And so many of our residents did not have a phone that would allow them a data plan to adapt to the changes and to do the services. So we set up Zoom, and then we had to configure our classrooms so that it could be a room where some residents could go in and do a Zoom meeting with their case manager or teleconference with case managers. And so we had to do that, and then we navigated in and out of the building. And so we consistently made changes to our plan as the news came out, and it was evolving every day. We were making those necessary changes. My staff, we saw some anxiousness with our staff as well as with our residents, but we saw anxiousness with our staff who was really struggling at first because they didn't know how to navigate this pandemic, because they're saying not to gather more than so many feet or more than so many people. And so now you're forced to work from home, trying to continue to keep up with your clients, making sure that your clients are okay. And so we began to change our schedules. We drifted in and out of the organization. We were there 3 days, 2 days, 1 day, just to make sure that we had that presence. But one of the greatest things that I think we were able to do in terms of easing the tension or the anxiety of our residents is we raised up ambassadors, tenant ambassadors, resident ambassadors, and we picked 4 or 5 residents who had demonstrated some leadership in terms of their peers. And we made those individuals ambassadors. They had access to me, whatever they needed, they had access. And they were pretty much the voice for the residents in the building when we weren't there. And so that was a very positive activity that we had done, because it helped to minimize some of the behaviors in the building, and it helped us to respond in a quicker fashion. And so we were able to do that. And then the other thing that I was able to do is look to my peers in the community, you know, to see what my peers were doing in the community. How were they dealing with the situation? I knew we were the only agency of this kind where our services was right there on the same site as our residents' homes. And so looking to my peers to see, you know, what are you doing? And then implementing what they're doing, and then they're implementing some of the suggestions that we had. And then working very closely with our board of directors. We had a board of director. One of our board members worked very closely with us with the COVID-19 response plan. So we were just a very tight-knit group, you know, and one of the things that I have to say about leaders during time of crises that you have to practice before a crisis is you have to know your team. You have to know your every team member, from the maintenance staff to the upper administrative staff. Because during that time, when there's a crisis, you have to know who you're going to be able to depend on. You have to know who's your go-to person during a crisis, because just because I'm a professional doesn't mean I handle crises well. And so when you know who when you've gotten a chance to have a relationship with your staff persons, then you know how to navigate the storm. You know where to put them. And so we also had a case manager who emerged as a leader as well during this process, and took on a lot of the responsibility of the clinical side of things, making sure that our statistics were still in place, making sure that our clients had constant communicating with her peers, making just there. And so we went through a trying time. We had lost some of our funding yet through this process. However, the community wrapped their arms around us, and we were able to get some support from the Cleveland Foundation. We were able to apply to the PPE loan. I stayed up all night waiting on the application to come through, because as a leader, you wait, and it was a competitive process, and we wanted to be.
I'm going to have to ask you to wrap it up.
Okay, and so we wanted to be in the first round. And so that's pretty much what we did, is that we just built a team and navigated the crisis.
Okay, thanks so much. You really sound like you're no stranger to crises, and you've got some experience under your belt for that, but you did a lot of the things we talked about too. You learned new skills, you took the big picture, looked for your emergent leaders. I love it, great examples. Now we will hear from Eric McGarvey. Go ahead, Eric.
Thank you. So a lot of great things were mentioned so far. I'm going to sort of walk you through kind of our process in dealing with this pandemic, and I think you'll notice that a lot of what we were able to do applies to sort of the outline that was presented earlier. You know, I remember where I was when I realized that this was a serious situation. I know we had heard things in the news and the media in the late winter, and I was actually with a couple of colleagues for an organization that I sit on the board for when we realized that this was going to be serious and that we needed to go into immediate contingency planning mode, not just for that organization, but for somewhere on the Cuyahoga as well. And so that's exactly what I did. Is we have a very small staff. It's just myself and one other employee, and then we have 2 temporary staff members in the summer. And so my assistant director and I immediately started our own contingency planning and what ifs. I took the time to speak with my board chair immediately, and then consequently rolled out communication to the rest of the board so that we could start thinking about the contingency planning process. And one of the first things that I felt was really important to do was look at our financial situation and just make sure that we didn't have any major contracts out there that needed to be addressed for the time being, and also make sure that all of our stakeholders received immediate communication on sort of what we knew and how we were addressing the situation out of the gate. And I can't emphasize enough how important that communication aspect is, communicating with all of your stakeholders. And we have 4 primary groups. We have our students, over 1,000 of them were registered on our portal to hopefully, get paid internships for the summer and come to Cleveland. We have our employers, over 40 of them, our school partners, our board of directors, and our volunteers, of course. So, we started to develop plans A, B, C, and X, and we made sure that we established a couple of task force groups to help us with that from the board. And we're constantly receiving input from them. One of our task force groups was, operating on the presumption that we would have to cancel the program altogether for the year. And another looked at alternatives. And while they were doing that, the staff continued to do our work. There was a lot of data collection involved, and that, I was doing just more research than I've done since I was in the M&O program. It was a lot of late night reading and printing of, PDFs, articles, and so forth, and kind of disseminating the information that would be the most helpful and the most factual. Constantly reviewing the daily briefings from state, federal health departments. Just gathering facts for our board and for our stakeholders so we can make good decisions. We also made sure to survey some of our stakeholders. We surveyed our employers and our students just to really understand how they felt about the situation and sort of what their limits would be for this season. Should we be able to go forward with some type of a hybrid situation? Again, we have employers that, some of them, of course, had to cancel because of hiring freezes, budgeting issues. They had their own issues within their own organizations, but then there are others that still desperately needed that help, even if it was in a virtual sense, because they are sometimes frontline organizations that depend on summer help to get through. So we had to take all of that into consideration. The surveys were very helpful. What we learned from the students is that they were scared. They were not so much scared about the pandemic itself, but scared about the consequences of the pandemic as it would affect them mentally and with their professional development goals. We had to keep in mind that they had already really lost a semester, and that has a really negative effect on their well-being. And so those were some of the considerations as we were making our own decisions. We solicited advice from professionals. I was not only getting advice from my personal accountant, but of course our organization's accountant. I wanted to get all the facts that I could. Peers, other nonprofit leaders that I know, we talked frequently, shared our concerns. And I think this was a situation where you had to learn not to keep so many things close to the vest. You got to really let some of that out and talk through some of those challenges with your peers, because there could be a solution out there that would be helpful that you may not have thought about. And then we also, were lucky enough to have a couple of our board members that were past participants of the program. So we got different perspectives from them on what we might consider going forward. We, of course, took immediate actions to safeguard ourselves with some of the government grants available. We were fortunate enough to receive PPP assistance, although with a small staff, it was definitely a smaller amount compared to most. And then we, kind of stepped back and looked at the consequences of not having a program this summer and what kind of effect that would have on our employers and our students. Also, we looked at the consequences and risks of doing a program in a modified status. And so we had all these contingency plans ready to go, and then it was sort of a wait and see because we needed more data. We needed a little bit more information on when the governor was going to ease certain restrictions. We were dealing with potential quarantine safeguards that were in place. And so thankfully in early May, we were able to make a decision, and after a long and thoughtful discussion, the board agreed to move forward with a hybrid program, which really allows us to be adaptable to the situation. And traditionally we have all of our students come in and live in Cleveland so they can experience Cleveland. It's sort of an immersive program. And we've had many students come back to Cleveland permanently because of that program. But now we have to adapt. And so we're doing a virtual approach, which will help make sure that students that are participating from afar are included as much as possible. And then for those students that are still coming to Cleveland, really putting in safeguards to make sure that their wellness is top of mind. And we have fortunate to have a physician on our board that led a task force to create a health and wellness preparedness plan that looks at what we're doing to keep our students safe on the front end, as well as in case anyone becomes ill. And so those are some of the realities you just have to really dig into. But you know, at times there were a few days that would go by where you just weren't sure what was going to happen. There were too many missing pieces in the puzzle. And so it was sort of that hurry up and wait approach for a while. During that time, you know, we kept doing the research. We were involved in a number of webinars on how to move forward with something like this and how to address stakeholders. And then once we did know we were moving forward, it was back to that whole communication thing. Let's let each stakeholder group know what our plan is. Let them know that it's a plan that will continue to evolve. And you know, Sherri mentioned earlier a living, breathing document, and I know exactly what she's talking about because we have that right now. Every day it gets updated and changes a bit because we're continuously looking to improve our plan to make sure we have as successful of a summer as we're able to. And we are taking an above and beyond approach, innovative approach, and we're exploring territories that, you know, we never would have thought of before, including new technologies like Zoom and how to use Zoom with other platforms. How do we leverage the experience and excitement our students have for things like this so that we can get them involved in the process? All things that we're considering. And the above and beyond includes things like we're going to be trying to help as many students as possible that aren't even our own students. So we'll be offering some of our virtual programs free, you know, to students out there that just have no opportunities this summer. We think it's important that there's something there for them. We're even listing for the first time ever unpaid opportunities or short-term projects, just because again, we want to help as many students as we can. And then in addition to that, we've created a living Google Doc that's a resource for students and employers, and we're constantly adding to that opportunities, articles, and curated information. I'm almost done, but I want to kind of talk about how we, you know, deal with the stress of this situation. And, you know, I think I legitimately woke up one night and was like, oh my gosh, the funding, you know, cuts, the loss of revenue, and the potential for, you know, having to make staffing decisions for the year and things like that. Those are all things that are very real problems and they can really weigh on you, but you've got to learn to sort of put those in their own box and make sure you plan as well as you can for those situations, but don't let them keep chasing you in your dreams. You know, I even remember at one point thinking something like, what would Linda Springer or Dr. Fischer do in this situation? We didn't really cover, you know, crisis management that much in school, as I was, you know, joking with a colleague of mine from the program. But for real, that program really did help us think of things we wouldn't have thought of before, as well as past experiences that we were able to bring to the table. And I was fortunate enough to look at this from a board member perspective, because I do volunteer on a couple of educational boards, and just seeing what those leaders did to kind of rise up to the challenge and meet the needs of the stakeholders, which in those cases were students themselves, was definitely motivating and helped us make some of our own decisions. And so now we're focused on delivering as successful of a program as we can by also inspiring and supporting as many students as we can, even outside of our organization. And we're also, you know, revisiting things like how do we approach development now and sponsorship asks. You know, it's a completely different perspective. So we're kind of talking about those types of things and bringing awareness about how these types of challenges impact stakeholders. I can't imagine how it impacts stakeholders for frontline organizations like the work that, you know, Danny, Sherri, and even Seven do. But yet, you know, we still have stakeholders of our own that are also impacted greatly. So that's kind of a summary of how we've sort of tackled this. And right now it's kind of over planning and staying organized. That's kind of the motivation of the day. So
Thanks, Eric. You may call it over planning, but the leadership behavior you exemplified is identifying the challenge. And since it was so vague, I think you were wise to create contingency plans and figure out what you do with various challenges. And then your survey to get participation from other people. So excellent examples of adaptive leadership. I see there are some questions here. Rob, I'll turn it over to you.
We do have a couple of questions in the chat. One is about what Sherri Brandon mentioned about the competition that exists around emergency funding for organizations. And the question is about how do you respond and kind of cope with this competition, given that, you know, we're all serving populations that are in need and support and at risk. Can you give us your thoughts about how, I mean, I think immediately of the COVID Rapid Response Fund that's been created here in Cleveland with $8 million bucks rapidly. But how do you sort out being drawn into that competitive model, maybe where it hasn't been like that in some spaces before?
Well, I think during the COVID, it was less competitive because I found that a group of funders, the philanthropic community, came together and really got a grip of what nonprofits face. And they were there to solve the problem. And yes, you had multiple organizations who applied to the funding, but the foundations had consistent communication with the organization or with us. We were able to share, we were able to change and update our information to them, and we were funded. But you know, I saw a different picture of our foundation community. Even they came together to collaborate to bring a solution to the situation. And then we were in the process of getting an answer about one big piece of funding because we're building a new facility. And all of that was put on hold, which is understandable because there was a greater community to address. And so outside of a crisis situation, when you're competitive, that's when you really showcase who your organization is and what you have done and how well you fit within the vision of the funders organization. So I hope that helped you.
That's what I was thinking. I didn't see it as, it's always competitive because there's a lot of great nonprofit organizations here in Cleveland. And we also know our community is super philanthropic, but I didn't see it as competition. To your point at the end, I saw it as an opportunity to showcase our organization, to educate the funding community about what our needs are and how this is what would impact us and continue to impact us. And so our job was to showcase our organizational strength and our organizational challenges and be honest about them. Nobody likes nobody likes to invest in sinking ships, right? And so there's a balance in the way that you say, that you demonstrate that, this is what your opportunity is, what your capacity is, what your potential is. And these are the things that this organization or this philanthropic or this donor has, or to be able to support our continue to do the good work. And so it really, we really rallied to showcase that we were ready as an organization to be able to accept those funds, to pivot. If we had any special projects and funders said, you can use this funding for operations, to say, all right, that's a great idea. And thank you for giving us that vote of confidence that we're gonna do the right thing with the funding, but then continue to communicate with them that we're doing this and we think we can do this aspect of our special project. We're a strong organization. We're strong for Cleveland. We're strong for greater Cleveland residents. So invest now while we're in crisis, and we're going to continue to lift up the community as we continue to do the work. I would say as a leader, it has been frightening and also exhilarating to be in an organization that has, it's not over. I'm not saying it's over, but that can stand up to withstand, with the support of many, the crisis that we're going through right now.
You know, Rob, I would agree with Sherri that this has actually been an environment where fundraising has been a little easier in some respects. People respond to crises more quickly than they do to the mundane, normal costs and expenses of dealing with a problem. The challenge that I think we faced, and we got funding through the PPP program, we got funding from Cleveland Foundation, CMS, the Centers for Medicaid and Medicare Services, gave us funding we didn't even ask for. Medicare gave us an advance on our Medicare funding. Our concern is that some of this is so focused on COVID-related expenses and so time limited, like the PPP loan, you got an 8-week period that you got to funnel that in. My concern is that we got all this money in, and I'm not sure I'm going to be able to track it to the expenses that they're requiring that you tag it to. And so our hope is that as time goes on, they will start to release some of these restrictions, either expand the period of time that you can apply the funding for, or give you a little bit more flexibility on the types of things that count as expenses. So the money's out there, but I think it's unrealistic some of the limitations that are being placed on how you can spend this money.
Complicated.
Eric, you want to add anything?
I think my colleagues covered it all. I would just say that, some organizations some organizations really depend on corporate giving as well, and that we are going to see some challenges with this year, unfortunately. Other than that, and donor fatigue, I agree that this is as long as you're showing resiliency and showing that you can rise up to get through challenges like this, donors are likely to be responsive.
I'll
Is donor fatigue real?
give you the first bite at the next question, which is about volunteers. The question is, any strategies that you've come up with about how to best engage volunteers during this time, or is it the case that it's just too challenging to engage the volunteers right now to even continue using them? But how do you maintain, given that's one of our greatest assets in many of our organizations, how do you keep them engaged? And Eric, I thought about your stakeholder analysis that you provided. How are you approaching this?
Right. So, we have an awesome volunteer group, and a lot of them are alumni of our partner schools that live in the Cleveland area. So they're actually true role models for our students, and they serve as mentors every year. We call them hosts. We made sure that we were communicating with them throughout the process, and now we are presenting them with our plan and asking them to buy in. And so we actually have a host meeting tonight virtually for all of those volunteers, and we're letting them know that, whether our students are coming to us in person or virtually, they all still need that support. And so when you lay out the plan that's in place, including the health, wellness, preparedness, and what steps we're taking to be safe, and also, the need that still exists for our student stakeholders, we're seeing our volunteers again, rise up and meet that challenge. And so we're thankful for that, but it goes right back to communication and just letting them know what the plan is and exactly how they can help, whether that's financially through donations. We have a wish list of just supplies we're trying to receive to equip our students with. If they can spread the word on social media and how this program, impacts students, whatever they can do, we're asking them to do it. And in many cases, that's just being a strong mentor for our students.
Yeah. We had an uptick in volunteer requests. We have a nice core group of volunteers, and an ongoing volunteer training that happens maybe once or twice a month. And we noticed that because people were home, they really reached out, and they We feel like we're fulfilling a need during the crisis. We always are fulfilling a need for people to do meaningful volunteer work, but certainly when we saw the uptick, and I'm sure you all saw this, we were feeling a need for people to be able to do something during this crisis, right? So they were in the following the stay-at-home orders, and they wanted to do something. And so what we figured out is that we needed people to make phone calls to our seniors who deal with, isolation and things like that. And so we conducted a mini Zoom training for those and gave folks a script to follow to do individual on their own schedule, and then with an agreement with the person that they were calling to do weekly calls just to check in. And our first round of that was 25 volunteers. I don't know the data, the information for the follow-up. And it's been really great to have those individuals go through that mini training. Some new volunteers, some current, but some new folks to be able to support our seniors. And so I think what we're seeing is that, volunteers help us, right? I think we're also helping volunteers. We're helping people to do something. I had 2 people, which I think is very interesting, and then on the donor side of things, that received stimulus funds and called. One called and one sent a direct message to me saying, I received this money and I need to do something good with it, so I'm going to make a donation to the center. Not all of it, but some of it. So it's very interesting. I think we should continue to pay attention to our ability as organizations to provide meaningful opportunities for people who might not have thought about volunteering. They're working, they may give some money, but while we're all impacted with this and not knowing what to do and how to help, to create ways for individuals to help, I think is part of our job as nonprofit leaders.
I know for our organization, we have been maintaining that relationship with our volunteers as well. We have a volunteer coordinator who really garnered the support of our volunteers. We're in the middle of our capital campaign and building a new facility when all of this hit. And so our volunteers are still volunteering and making sure that they're meeting the needs of our capital campaign. But we've also had opportunities where volunteers, instead of coming in the building, they have made little trinkets for our residents and brought them to the building. We have opportunities where volunteers can do a Zoom meeting with our residents, whether it's a resume writing class or interview skills or whatever the need is. We have that capability, and we have volunteers who have been open to volunteering and doing that as well. But so we still continue to communicate with our volunteers. We continue to send information. And the greatest thing about it is we have been receiving donations from lapsed donors during this time. So we're still out there in the community. We're still sharing our story, and volunteers are still volunteering. We have a youth group that's coming in, I think it's around June or July, to really do some volunteering around helping us to relocate our offices to our new location. So I think it's vital for volunteers to stay close to the program, for the organization to continue to work with volunteers and to share with volunteers and create opportunities where volunteers are valuable and feel valuable and in their ability to continue to help us forward our mission.
All right, I know we have about 10 minutes left. We have another question I wanted to get in front of you guys. This one is about something a couple of you definitely mentioned, and that is about drawing boundaries between what's going on in your work and your personal life and the strain and stress that you're feeling in new ways, and you're seeing it in your own staff. How do you help folks, yourself, I think is the focus of the question initially, but more broadly, your staff, how do you help navigate that challenge?
Well, one of the things that I do every morning at 9 o'clock is I send an email to the entire staff. It's only 15 of us, so it's not like I have a huge staff, and I say good morning. I say good morning. I give them a little bit of anecdote about how I'm doing, you know, and what I'm going to be focused on today, and my availability. And you know, the first 3 weeks I got a good morning back. I get one or two, but I know they're working. We have a team meeting every Tuesday, and everybody's on. And so, you know, I let the staff get through the Monday with just the good morning. I switched to whoever responded first with a good morning to surprise, you've won the contest for the day. DoorDash lunch to their house for, place. I got candy from a local independent candy store and made little packs. And so somebody responds, surprise, here's candy on, for you. We have a schedule where some of us go in the office to get regrounded now, where we're not necessarily working together, but we know that we're there to be in the building. It's hard to separate it. I get up, I do my thing, I sign off at a certain time, but I'm really not signed off. I always have my phone. I think somebody mentioned it before, like, it's hard to turn off. It's a crisis. And so as leaders, we're supposed to be on the front line. And, I have fun. People have seen my silly side. I have it, like they've seen my serious side when I'm being directive. And I've been, I think, like trying to incorporate being compassionate, showing compassion for myself around when I'm feeling overwhelmed and signing off, but being honest about that and showing compassion for my team. So in our phased reopening that we're going to start on June 1st, I asked publicly to the entire team about their feelings about going back and what they feel like that they would need, and then individually, because I felt like they might not say it if they have some apprehension about coming in. And I have the privilege, because I know every organization can't do this, to allow staff to tell me what their schedule is going to be. How do they feel comfortable? And then I said, when you come in, if that something changes, we'll talk about that. So it's a, we have this slogan, in it together. That's how I'm thinking about it as I approach my staff around both my own boundaries and how I feel and when I need to take a break, and what they might feel. So first 8 weeks, I was great. I had 2 weeks where I was super challenged, and I was slow coming out of it, and they helped me because I was able to say, this sucks, and I need a break or whatever.
Rob, the one thing I would add is, excuse me, for staff, every staff member has a different set of needs. It may be a childcare issue. For some, it may be dealing with, an aged parent who's, maybe sick with COVID, maybe not. I mean, I think what we've tried to do is to be as flexible as possible in allowing staff a little bit more leeway. The hard part of that is, there's probably somebody who's abusing that, but now's not the time to be the police. So you just have to accept the fact that, there may be some who are taking advantage of it, but overall, I think you have to send a message that if you've got a real need, a real concern that's arising from this crisis, we're going to do our best to try to help you work through it. Personally, I guess I would say I have ridden my bike much more in the last 2 months than I have in my entire life. I got a little app that I put on it, and I measure where I'm going. I've explored some great places around the city, and that's helped me a lot. And I enjoy music. I picked up a new instrument, started playing a harmonica, and I'm not good, but I enjoy it. So, it's just trying to find some ways that give you pleasure and keep your blood pressure down. And then also try to show some empathy for the people who you're working with.
Yeah. For our organization, again, we meet three times a week and we really talk about what we're feeling, what's going on. One day, I also sent this to Linda Springer. I took a picture of myself with my suit jacket on and my pajamas on, because that's, and I named it the new COVID office attire. And so because we're in front of Zoom, we have to show ourselves presentable up top, but you can have on what you want at the bottom. And so I had my pajamas on. I took a picture and I sent it. But I think, and I still carry that open door policy. My phone is available. Staff can call me at any time that they need to have any conversations. And we just try to do the best we can. And then for me personally, I am a woman of faith. And so prayer is always the center of my life and what I do. But I have found myself at times having to push myself away from work, because I can work from 8 in the morning, sometimes to way hours of the night. And my husband said to me one day, "Aren't you tired?" I said, "Well, not really," but it was late. And so I jump rope. I like to jump rope. I like to exercise. Don't do it as much as I want to, but I jump rope every morning. So that's my, that's how I relax and stay grounded and centered.
I would just add that, on the work side, we try to make the best of this and have a sense of humor where it's appropriate on certain things, and just kind of do a wellness check with each other and the board members that we work with the most behind the scenes. And then, personally, again, I'm one of those people that I tend to get a lot more done at night when the emails aren't flying in. And so I do admit to working in the evenings, but I also make time a couple of weeks for like Zoom happy hours with friends and just kind of catching up with people and checking in with family and things like that. And then as allowable, trying to get outdoors and just doing a long walk or a quick run just to kind of get the blood flowing and think. But yeah, I realize the importance of kind of separating the two as much as you can when it's possible.
I see that guitar back there. Do you play that?
I don't. It's actually for show. It was the 10th anniversary for SOTC. It was signed by all the students as a gift from the Rock Hall.
Oh, I heard Danny say about the harmonica, and I sent him a private message that I picked up the ukulele, so I thought we were gonna have a band.
Oh man, I'll figure out something to do.
All right.
I can sing a little bit.
Right on. We got our singer.
Well, Linda, I think we're right at time, and I was going to give you the last word. My one request is, I know we're going to do another one of these, and now I'm thinking it's going to be ukulele, harmonica, and jump roping session for us all. But to everybody on, if you have other things you'd like to see us do in this kind of format while we can, feel free to email me or Linda Springer about ideas that you might have. We're totally open to that. And with that, I'll thank the panelists, but I'm going to give Linda the last word.
Well, I just want to thank them too. And you just had real life, what I call boots on the ground experiences with managing crises. And I love how you related it to the concepts that we opened with, to show that, that you're really making it work and you're doing it in really conscious, intentional ways. And we're just proud to have you part of our community, part of the leadership in Cleveland, and thanks for joining us today.
Thanks, everyone.
Thank you for having us.